My name is Shea Kosokowsky, and I am performing the first part, Part A, of the Health Assessment Lab video, the mental status examination. I have my appendix for reference. It doesn't have anything extra on it on either side. And I'm just placing them on the table here behind me for that. I have my random letter test and serial 7 answers on a piece of paper, but no extra information on it, and a couple of scraps of paper. So this is Matt, he's my volunteer, and I'll do a quick scan of the area around. Good lighting. And that's where the camera is mounted. Now I would perform my hand hygiene before I entered the room. Hi, Mr. Silva, how are you today?
I'm alright.
Good, good. Can I just check your ID band there? Perfect. Can you tell me your full name and birth date?
Matthew Silva, January 21st, 1990.
Okay, excellent. So, my name's Shea. I'm going to be your student psychiatric nurse today, and we're just going to ask you a few questions. Can you tell me why you're in today?
Just feeling a little down.
Okay, perfect. So we'll look into those feelings a little bit later, but first I'm just going to ask you some questions, okay?
Okay.
First of all, I just need your full name and birth date, which I have already. So, your occupation.
I'm an automotive service technician.
Okay, excellent. And your marital status?
Single.
Okay, and just your phone number and address.
Phone number is 204-792-1770. My address is 23 Burrard Way in Winnipeg.
Okay, and I can reach you at that phone number if I need to?
Yep.
Excellent. So I'll just ask you some questions about your current health. So about how long have you been feeling down, as you put it?
Probably about a week.
Okay. And, what came up from it? How did it start? Do you know, or was it just kind of...
I'm not sure. It just kind of brought itself on.
Okay. Now, how are the health of the people in your family? Are they any physical ailments? Anybody have a cold or anything?
My mom's got a bit of a cold, but nothing serious. Everybody else good that I know of.
Okay. And are you all up to date on your immunizations?
As far as I know.
Okay. Now, how about your past health? Have you been hospitalized for any reason?
No.
No, any surgeries or any kind of childhood disease that you've had?
No, never.
No? Okay. And how about the history of your family? So do you have any history of stroke, diabetes, obesity?
No. Slight history of cancer.
Cancer, okay. And how about as far as depression or any kind of schizophrenia or alcoholism, anything like that you know of?
Not that I know of.
No? Okay. So we'll just talk a little bit quickly about your feelings about being down. Now, you mentioned it's only been on for about a week. Are these feelings normal for you? Have you experienced them in the past?
No.
No, they're not. Okay. Now, have you ever thought about hurting yourself in any way?
No.
No. Okay. Okay, so I'm just going to ask you a few questions here to assess your some thought processes here. So you mentioned that the feelings aren't normal for you, but that you feel that they've been brought on by something. Do you have something, stress in your life that you feel has had this brought on?
Not really that I can think of.
Okay. And how about, do you feel like you have any special powers?
No.
Do you feel as though you've had thoughts before that other people thought were strange?
No.
No. Do you ever hear your name called when you're alone?
No.
No. Do you ever see things that other people don't think are there?
No.
Okay, so now just going to talk about you a little bit here. So do you belong to any groups, any churches or teams or anything like that?
Not at the moment, no.
No. Okay. How do you feel you fit into society?
I feel like I fit in pretty well.
You do? Great. Do you have a sure sense of who you are?
Yes, I feel like I do.
Yeah. Do you like you?
I do.
Now tell me, do you, what's your ideal weight?
Probably about 180 pounds.
Okay, and what's your current weight, just so I know?
About 175.
If you could change something about yourself, would you?
Physically or
Physically, sure.
Physically? No.
Okay. How do you feel when people criticize you? How do you react?
It probably depends on who's doing the criticizing.
Okay, can you elaborate just a little bit?
I feel probably if it's somebody that I feel has more experience than me or more knowledge than me in the area of being criticized, I think I'd probably react more constructively to them, versus if it's somebody that I think is just giving me opinion on something just to give me their opinion. If I don't agree with it, it probably would be a little bit more of a negative reaction.
Okay, fair enough. Now, do you feel suspicious of friends when they're overly nice to you?
No.
No? You wouldn't say
No.
so? Okay. Okay, so first, can you first tell me the date today?
Today is November 2nd, 2015.
Okay. And do you know where we are?
Yep. We're at my mother's house in Winnipeg.
Okay, and the address?
23 Burrard Way.
Excellent, thank you. Okay, so just going to do a couple memory tests here. First, I'm going to say 3 words that are unrelated to each other.
Okay.
So the words are blue, camel, dress. Okay, can you repeat them back to me?
Blue camel dress.
Okay, perfect. So in about 5 minutes, I'm going to ask you to repeat them to me, okay?
Okay.
Excellent. Now, do you remember my name?
You're Shea.
Thank you. And what was the year of your high school graduation?
2008.
Okay, now I'm just going to ask you some questions, just some random questions. Do you know where the Taj Mahal is?
I think it's in India.
Okay. Can you name me the Mayor, Premier, and Prime Minister of Canada? Mayor of Winnipeg.
Mayor is Brian Bowman. The Premier, oh man, it used to be Gary Dewar. Now it is, oh man, I want to say Sullinger, but he's not the guy. I can't say who the Premier is. The Prime Minister is newly elected Justin Trudeau.
Excellent. Okay, that's fine, don't worry. And then, can you name all the provinces in Canada?
Yes.
Can you do that for me, please?
Alright, provinces and territories?
Yes.
This is like a test. Alright, so you got Yukon, Northwest Territories, Nunavut, BC, Alberta, Saskatchewan, Manitoba, Ontario, Quebec, New Brunswick, Nova Scotia, Newfoundland, Prince Edward Island.
Okay.
Pretty sure that's all of them.
Great. And do you know what years were the World War II took place?
I know it was the 1940s. I think it was somewhere around 1940 to 1944.
Okay.
Something like that.
Okay. Now I'm just going to ask you a couple questions to do. Yeah. If you found an envelope on the sidewalk and it was signed, sealed, all of that kind of stuff, and you found it on the sidewalk next to a mailbox, what would you do?
I'd put it in the mailbox.
Okay. And if you were at a movie theater and you smelled smoke, what would you do?
Probably look for fire.
Okay. Now I'm going to get you to draw me a clock. The time is 8:40. Thank you. Okay, now I'm just gonna do a couple little tests. Okay. I'm going to say a series of letters. Okay? I want you to go like this with your hand when you hear the letter A. Can you do that for me now? Great, thank you. Okay, so ready? F, B, A, C, M, N, A, J, K, L, B, A, F, A, K, D, E, A, J, A, M, O, F, A, B. Okay, now I'm going to get you to count backwards from 100 by 7.
Holy smokes.
Starting with 100.
Okay, 100, 93, 86, 79, 72, 65, 58, no, 57, I think I messed this up.
It's okay.
Okay,
You're good,
57,
you're good. 58.
50,
58.
no sorry, 58, 51, 43, 35, 27, 20, 13, 6, no, 5.
Okay, thank you. Okay. Now, I'm going to name a series of proverbs. Can you tell me what they mean? Okay?
Okay.
People in glass houses shouldn't throw stones.
You shouldn't dish it if you can't take it.
Okay? 2 heads are better than 1.
People are better when they work together.
You shouldn't cry over spilt milk.
Don't dwell on bad things that have happened.
Okay? Now, can you name those 3 words I asked you to remember before?
Blue camel dress.
Perfect, thank you. Okay, so that concludes the mental status examination. Now we would move on to the physical examination. This is part B of my health assessment assignment, the physical part. Here is my appendix. I'll do a quick scan of the room. That's where the camera's sitting. Well, thank you for answering all those questions, Mr. Silva. I know they seemed random and all over the place, but they will be helpful in the end. Do you have any questions about anything that I asked or we covered?
Nope.
No? Are you on any medications I need to be aware of
No.
at all? No? Okay. Alright, so this is the physical part of our assessment, so I'm just going to do a series of tests on your body and I'll walk you through the whole thing and just let me know if you feel any level of discomfort, okay? So first we're going to do a skin turgor assessment. So I'm just going to pull your shirt down a little bit and pinch a little bit of the skin underneath your clavicle. I'm just looking for the rebound of the skin, and it looked good. So have you had any extreme weight loss in the last little while?
No.
No? Okay, and how much water do you drink a day?
5 to 8 cups.
5 to 8 cups. Perfect. Okay. So now we will do your lymphatic assessment. So I'm going to feel different parts of your head and neck, okay? Just let me know if you feel any tenderness.
Okay.
So first we're going to go look at your preauricular nodes, which are anterior to the ear. Then your postauricular nodes that are superficial to the mastoid process. Occipital nodes, which are at the base of the skull. The submental node at the tip of the mandible. Submandibular node, which is halfway between the angle and tip of the mandible. The tonsillar node, which is nodes, which are at the angle of the mandible. Then we'll move to the neck. So we have on the sternocleidomastoid muscle, just stay straight for now. We're looking for the superficial cervicals, so I'll get you to turn to the left. And the other way. Thank you. And the deep cervical, which are again on the sternomastoids, so yeah, perfect. And the other way. No tenderness or anything?
No.
Okay. And now the posterior cervical. So we're looking at the sternomastoid muscle, and there's the trapezius muscle, so it's going to be in the posterior triangle here. Find it on the other side. We'll get you to turn your head back and forth again. Perfect. And then the supraclavicular, which is in and behind the clavicle along the sternomastoid muscle. Perfect. Now, have you noticed any lumps on your neck?
No.
Or any neck pain that you've had? No. Perfect. Alright, so now we'll just move ahead to the eyes. Do you wear glasses or contacts?
No.
No? And have you had any eye surgery ever?
No.
No? Okay. So we're just going to do 3 tests. We're going to do an accommodation test, a position test, and a reflex test. So first I'm going to get you to look right at this light here and keep your eyes on it as it comes closer, okay? Perfect. Okay, and I'm just going to shine a light twice on your left eye and then twice on your right eye, okay?
Okay.
Other side. And the last one is a position test. So again, keep your eye right on here, and I'm going to move it, and you'll just follow the pen light, okay?
Okay.
Looking for him being able to follow the light and also any oscillation in his eyeballs. Excellent. Thank you very much. Okay, next we're going to do the ear assessment. So first I'm going to look at the external auditory canal. So I'm looking for any discharge, redness, swelling, any kind of foreign body around the ear, and I'm also going to just palpate for any lumps. Have you ever had any severe ear infections?
No.
Any trouble hearing?
No.
Then the other side. Good. Okay, now we're going to do 2 tests. So I'll get you to stand up and put your feet together and keep your eyes closed and just stay like that for 20 seconds, okay? I'm going to have my arms out in case you lose balance.
Okay.
Okay. Excellent. Okay, now I'll just get you to take a step forward. I'm going to put the stool behind you here, just move it ahead a little bit, and you can have a seat again. Other way. Thank you. Okay, now I'm going to get you to put your finger on the tragus. That's that little bone right here in your ear. And move it in and out, okay? So it causes a bit of a muffling sound.
Okay.
I'm going to say 3 words, and I'll get you to repeat them back to me, okay?
Okay. Tuesday, Thursday, Sunday.
And again on this ear. Friday, Monday, Tuesday.
Friday, Monday, Tuesday.
Great. Okay, everything looked good there. Okay, so now we'll just get you to take a step back here now that we have a little bit more room. Okay, and now we're going to do our mouth and throat assessment, so I'll put some gloves on. Have you had your tonsils removed?
No.
And when was the last time you saw the dentist?
3 months ago.
3 months ago. Good, you're staying on top of it. Okay, so I'm looking at the outer aspect of the mouth and lips, and then we're going to say ah. Excellent. Looking at both of the buccal mucosas, the condition of the teeth, hard and soft palate, sides of the tongue, underneath the tongue. Perfect. And the back of the throat. Good. Okay. Now we're going to do some testing of facial cranial nerve 7. So I'm going to get you just to, I'm going to say some expressions and I'll just get you to do them back to me, okay? So first, smile. Frown. Raise your eyebrows. Puff out your cheeks. Purse your lips. Bare your teeth. Perfect. Excellent. Okay. Now we're going to do some testing of the vagus nerve 9 and the glossopharyngeal nerve 10. Okay, so first I'm going to put this in your mouth and I'll get you to say ah. Excellent, perfect. Next, this one is a little bit unpleasant. I'm going to touch the back of your throat with this, okay, just to test your gag reflex. Good. And last, I'll get you to take a sip of water here. Okay, lastly, I'm going to test the hypoglossal nerve 12, hypoglossal nerve 12, and I'll get you to say D, N, L, T.
D, N, L, T.
Great. And then stick your tongue out, and I'm going to put this tongue depressor on the side of your mouth, and you're going to push against it, okay? And lastly, we're going to test spinal accessory nerve 11. So I'll get you to move your face back and forth. Good. And now I'm going to push, and you're going to push against the resistance, okay? Good. And shoulders up and down, and against my resistance again. Good. Perfect. Now, do you ever feel any tremors or anything?
No.
In any part of your body, or any dizziness?
No.
Okay, now we will do our lung assessment. So I'll get you to turn around on your chair if you don't mind. And we'll lift your shirt up a little bit so I can. Thank you. Do you smoke?
No.
Do you have a history of chest infections or pneumonia?
No.
Okay. So what's going to happen is you're going to feel my stethoscope on your back 10 times, okay? And every time you hear it, I'll get you to take a deep breath in and out.
Okay.
Okay? Okay, so I'm listening for rate and depth of the lung sound, as well as any extra sounds like cracking or wheezing, which I didn't hear. Okay, and now I'll get you to turn around again. We're going to do your heart assessment. So there's going to be 4 spots I'm going to touch with my stethoscope on the front of your shirt, okay? Now, do you have any history of heart disease in your family?
No.
Do you ever feel chest pain at all?
No.
Okay. So first we're going to look for the aortic heart sounds, which are going to be on the second intercostal space on the right sternal border. And I'm listening for the rate and the rhythm and any extra heart sounds. And now we're going to look for the pulmonic, which is also in the second intercostal space on the left sternal border. And I can hear it over top of his shirt. Now we're going to look for the tricuspid, which is 2 down, the fourth intercostal space on the left sternal border. And finally the apical pulse, which is in the fifth intercostal space on the left midclavicular line. Okay. Okay, next we are going to do the abdomen assessment. So I'll get you to lie down here. Completely flat. And just lift your shirt a little bit, if you don't mind. Perfect. Have you had any recent changes in appetite?
No.
Do you feel like you have pain in your stomach ever?
No.
Very frequently? No? Okay. Okay, so first I'm going to inspect the abdomen, looking for any distension or lumps or discoloration from the side at eye level as well as from the feet. Okay. And now I'm going to auscultate in the 4 quadrants. Starting in the right lower quadrant, I'm going to listen for bowel sounds for a full minute in each quadrant. And if I don't hear any bowel sounds, I would need to listen for a full 5 minutes in order to make that assumption. Now we'll do some palpations. So I'm just going to touch lightly on your stomach, and that is just to get an idea of any lumps or any kind of distension. And then I'm going to go a little bit deeper to feel where your organs are, okay? Just let me know if you feel any discomfort.
Okay.
When I was auscultating, I was listening to the character and quantity of the vowel sounds. So now we'll go a little bit deeper. You okay?
Mhm.
Great. Okay, so now I'll just get you to move up a little bit more so that you're kind of in a semi-seated position, or semi-Fowler as we call it. Now I'm going to find 8 peripheral pulses, and in this case I'm looking for the rate, rhythm, and equality of all of the pulses. Normally he would be on a hospital bed and at working height, and unfortunately I don't have a hospital bed, so down on my knees here. Okay, so first we're going to find the temporal, which is lateral to the eyes. And the carotid next, which is in between the sternomastoid and trachea, and that groove there, and I'm making sure to only do one at a time. Next is the brachial, so again I'll get you to, perfect, which is, I'm going to find it in the antecubital fossa. Okay, and the radial, which is going to be medial to the radius. And normally I would do the femoral, which I won't do in this case, but it would be here under the inguinal ligament. I'll get you to put your knees up. Perfect, thank you. Looking for the popliteal, which is going to be under the knee. and the dorsalis pedis, which I will find on the top of the feet. I can feel it through his socks. And the posterior tibial, which will be behind the medial malleolus. Okay, now do you ever have any cramping in any of your legs, feet, arms? No. Have you noticed any skin color changes in any of your limbs?
No.
Okay. Good. All right. Got you to have a seat again. And now I'll just get you to think back to a time where you had pain. Can you think of that? Can you tell me about that?
Probably the last time I had a headache.
Okay. Now, can you tell me where the pain was?
In the rear lower part of my head.
Okay. And did it spread at all? Or did it kind of stay localized in that spot?
Stayed in that spot.
Okay. Can you describe it? Can you use some adjectives to describe the pain that you had?
It's probably a sharp and throbbing kind of pain.
Okay. And had you ever had that kind of pain before, or was it new?
Similar to it before.
Okay. And at what time of day did it come on, and how long did it last?
Probably came in the morning, lasted for about 2 to 3 hours.
Okay. And have you had it since, or was that kind of a one-time?
Haven't had it since.
Okay. Can you rate the pain on a scale of 1 to 10, with 1 being no pain at all and 10 being the worst pain you've ever felt?
Probably about a 3.
3. Okay. And what do you think brought it on? Do you feel like that something brought it on? Were you under some stress?
No, maybe slept a little bit odd that night.
Okay. And did anything make it worse or better? Did anything that you did make it trigger?
Not that I know of.
No? Okay. Okay, and lastly, we're going to do a last assessment of cranial nerve 5, which is the trigeminal nerve, and also some sensory impulses. So what's going to happen is first we would do the corneal reflex, which I'm not actually going to do, but this would be something we would normally do, where I would take a cotton ball and bring it towards the cornea, and the patient would, in normal cases, blink. The sensory section of the trigeminal nerve is going to be with 2 tests, the light touch and the sharp and dull touch. So first we'll do the light touch, and in order to make it span to sensory as well, I'm going to not just do it on the face, but on the whole body. So what I'll get you to do is, as soon as you feel the cotton ball on your face, I'll get you to say now and tell me where on your body you feel it.
Okay.
Okay? So close your eyes.
Now forehead. Now nose. Now chin. Now left ear. Now right ear. Now throat. Now right elbow. Now left hand. Now left knee. Now right shin.
Good. And next, I will get you to give me your hand here. So what's going to happen is you're going to feel a sharp and a dull touch, okay? This is the dull touch, and this is the sharp touch, okay? Same thing. I'll get you to feel, tell me when you feel the sharp or dull and where you feel it, okay?
Okay.
Close your eyes.
Dull forehead. Dull nose. Dull left cheek. Sharp chin. Sharp right ear. Sharp throat. Dull right elbow. Dull left hand. Sharp left knee. Sharp right knee. Dull right foot. Sharp left foot.
Excellent. Okay, and do you ever smell something funny that isn't actually there?
No.
No. And do you ever feel, did I ask you about dizziness already? Did you ever feel
no,
dizzy?
but I don't feel
Don't
dizziness.
feel dizzy? Okay. Okay, do you have any questions about anything we've done?
No.
Okay. Well, I've gotten everything I need, so we will chat again soon, okay?